Um, Metformin is cool, Florida. It's not that good though. Like metformin is not that impressive. And when you're in my program, you rarely have to use metformin. Like we rarely have to rely on other medications outside of the GLP-1 and then maybe the but metformin, it's definitely the reason why I like it compared to other diabetic medications is because metformin actually increases fat loss as opposed to increasing fat gain. A lot of the other ones increase fat gain. So out of all the diabetic medications outside of GLP-1, that's the second best. So let me know, guys, um, where you're watching this live from. We got 4 people on Instagram. That's super cool. Orju, Estella, Ambium, K-Mac. Welcome, welcome. The old Instagram live has got a little traction. Oh, one person left. They said, I don't like Dr. Sweeney. And they said, I'm out. Okay, fair enough. So the protocol, in essence, what we do is I coach people to implement lifestyle change. Good morning, Ambium. Lifestyle change is what we implement, and we do it strategically with the individual. We got JK from Illinois. We got Wise from Texas. We got User from Miami. Miami Beach is one of my top places to visit because I play volleyball, by the way. So Miami's freaking awesome. I definitely plan on going soon. We got some Phoenix, some Arkansas, some Canada, Mossman. By the way, guys, this phone number right here, I'm gonna have to probably change the mirror. Boom, there we go. This number right here is actually the best way to reach out to my team. So all you got to do is shoot us a text message with your name and your email. Let them know that you want to get scheduled for that free consult, and my team will do the rest. And just so you guys know, if you end up working with us, you do the consultation. You like what my team has to say. You're like, I'm ready to rock and roll. You're going to work with me. You're not going to work with just my coaches. Depending on which program you do, my warrior coaching program is set up where we can actually get into it. Period or the shot itself. I think I know what you're trying to say, Gorgeous Creations, but can you elaborate? Good morning, Annette. Uh, I've been on Manjaro now for 7 weeks. I just passed my. Oh, okay. I didn't see your first message. I just passed my cycle and noticed I gained weight. Is it the period or is it the shot itself? The shot's not causing weight gain. These are weight loss shots. So it's not the shot. And to answer your question, who knows? I mean, there's so many variables that I couldn't give you an answer that had any credibility to it. I don't just haphazardly answer questions or, bullshit people. I can't do that. So who knows? I can tell you guys there's 4 main categories. So pay attention to this, guys. This is a powerful piece of information. The 4 main reasons why you would not be losing weight on your GLP-1 medication. Number one, hyperinsulinemia. Hyperinsulinemia is a condition that results from insulin resistance, where your body becomes less responsive to insulin. So your body has to produce more insulin to get the job done. This leads to hyperinsulinemia, aka chronically elevated insulin levels. And it's these chronically elevated insulin levels over time that create this state where your body's constantly trying to grow, store, store, store. And then number 2, we have inflammation. So inflammation drives, hey, Patrick, I'll get back to your question here in a minute. Inflammation can come from either autoimmune disease like Hashimoto's, rheumatoid arthritis. We've been seeing a lot of autoimmunes. Let me know if you have any of these issues, guys, so that we kind of get an idea. So we have autoimmune driven inflammation, and we have non-autoimmune inflammatory conditions, PCOS, menopause, post-COVID, Lyme's disease. These conditions drive inflammation. Inflammation drives insulin resistance. Inflammation drives weight gain. It slows down and prevents fatty mobilization. So now we're getting into some of the conditions that you guys are dealing with. Condition number 3, thyroid. How many hypothyroid patients and people do we have in the lives this morning? Clinical hypothyroidism is a medical condition in most cases which requires thyroid hormone, and you don't want to skip this because thyroid receptor activation is responsible for converting the food that we eat into the energy that we need. All trillions of your cells need thyroid hormone, and you're not going to lose weight skipping past a hypothyroid situation. It's very challenging. This is why we include comprehensive blood work in our program. We are looking at the TSH, the free T3, the free T4, the reverse T3. I see some of you guys are asking for more information. This phone number right here, all you got to do is shoot us a text message. If you want more information, if you want to get scheduled for that free consultation, if you want a more comprehensive look at what's going on, right now we're talking about the 4 main reasons why you would not be losing weight on your GLP medication. So we covered hyperinsulinemia, we covered inflammation driven by autoimmune and non-autoimmune conditions. We just finished talking about thyroid, hypothyroidism. Now, in the same category of thyroid, guys, I would be remiss if I didn't talk about weight loss, zombie mode, metabolic downregulation. Giselle has PCOS and lost 25 pounds at the beginning, and now I'm stuck. It makes a lot of sense, Giselle, because when you have PCOS, you have both elevated insulin levels and inflammation in most cases. And those existing conditions are going to exacerbate hyperinsulinemia. And like I said, the more hyperinsulinemic you are, the more your body desires to continue to gain weight, to continue to gain weight, to continue to gain weight. That's the vicious cycle. And then finally, we have cortisol, guys. We can't forget good old cortisol. So cortisol is a stress hormone, and cortisol is very powerful. Cortisol raises blood glucose. It raises blood glucose in an effort, essentially, to keep you alive, right? There's some perceived stress, and so your body starts pumping out glucose. And the way that cortisol gets glucose is not the cleanest pathway. It'll break down whatever tissue it needs to. It'll do whatever it has to get your blood sugar up because we're thinking tiger. We're thinking, holy crap, there's a tiger right there. You ever see a tiger, guys? Please don't run. The whole expression, run from a tiger. It's kind of silly, don't run from a tiger, but in any case, hopefully none of us ever find ourselves in that situation. But if you did run, nonetheless, your cortisol levels would be skyrocketed, glucose levels would be elevated, and you would have the fuel. Your skeletal muscles would have the fuel that it needs. The problem with chronic stress is cortisol levels are chronically elevated, and when cortisol levels are chronically elevated, now you guys get the pathway here, right? Cortisol, glucose, insulin resistance, hyperinsulinemia, obesity, right? It's a chain. Patrick on YouTube. So you know there is really good research, Patrick, on polyphenols for visceral fat. So I'm not opposing what you say at all, and I think this is this is a really interesting situation. Um, should you supplement with polyphenols if you're on a carnivore diet? I know a lot of people, um, a lot of carnivore docs would say no, but I feel like a lot of them would say no without actual scientific basis for that statement. Um, so I don't have an answer for you, Patrick. I would say that if you have a lot of visceral fat, and you want to get the benefit of carnivore diet, but you have a lot of visceral fat, carnivore diet will take care of the visceral fat without a doubt. But would there be a problem with adding polyphenols? You know, probably not. But Ryan, what's up, buddy? Brian said we got Ryan and we got Brian. All right, we got Ryan and Brian, the duo. Patty, any ketone issues for people? Mine got really high. Uh, your ketones got really high. Can you tell me more about that? Logan, if you think you can beat my pricing, feel free to shoot me a message here, Logan. Ambien, yes, you can buy from us, absolutely. I'll send you a message right now. I just sent you a message, Ambien. Send me a message back. Let's talk AOD. Um, there's many different ways to cycle it, so I recommend that we get you scheduled for a free consultation. Can you speak about your affiliate training program? Where do I go to find more information? Yes. So the ambassador and the affiliate programs. Let me tell you guys the difference. So an ambassador is like a cheerleader, but it's like a cheerleader. It's like a brand enthusiast. It's like our groupies. I don't know what the heck you want to call them. People that are really, really just that resonate with the program. Usually, my ambassadors, I want you to be in the program. You do get half off of our price. And the requirements are just to be active within the community, to support, to help the newbies, things like that. So if you want information on becoming an ambassador, you have to meet our manager. Her name is Dawn, and she'll talk to you and go from there. So if you want information about becoming an ambassador, just shoot us a message right here. If you want information about the affiliate program is essentially doing something like what I'm doing right now. Yeah, groupie was not the best choice. As I said groupie, I'm like, maybe you know what I meant. But yeah, just I think you'd be great, Moss, because it seems like my stuff really resonates with you, and I appreciate that. So, the affiliate is somebody that just leverages their audience and gets them interested to come into our system, just like I'm doing now. And then if people get enrolled, you make commissions. Pretty simple. Firefly. All right. Guys, if you just joined us here in the live, welcome, welcome. So, my name is Dr. Jones. I have clinics we service across the nation, all 50 states. In essence, what we do is we focus on coaching you guys for long-term lasting weight loss, utilizing low doses of GLP-1 medications and powerful peptides with the goal of permanent weight maintenance. It's really that simple, guys. Permanent weight maintenance. Doesn't that sound pretty amazing? I don't know about you, but permanent weight maintenance. If you would have told me that when I was in my early 20s and I kept regaining and losing weight over and over and over after I lost my 100 pounds, and I felt like I could never, um, I felt like I could never maintain my weight loss. If you would have told me that was possible, I would have been all in. Problem is I couldn't figure it out then. The key, the key to permanent weight maintenance You know what's crazy? When you look at the research, by the way, permanent weight maintenance. There's research on this, by the way. The I call them unicorns, the unicorn research. The unicorn research, they actually looked at people who lost a bunch of weight and actually successfully maintained it long term. You guys ready for this? They identified which characteristics existed among individuals who successfully maintained 10% of their weight loss. I think it was like 3 years, like something reasonably long. And the only identifiable trait was all mental related, you know? It was all mental toughness traits. They counted their calories every day. They exercised every day. They had a strong supportive community. They had methods for dealing with anxiety or depression. So when you look at those characteristics, you learn something. You learn that mental toughness is always going to be a variable. You learn that mental toughness is always going to be a, a thing, an aspect, a variable to consider. And you need to understand that strengthening the mind is the most powerful tool that you have. But the reason why it's called unicorn research is because it's rare. In my opinion, it is rare that most people possess enough mental toughness to override their body. So I want you guys to pay attention to this because I've actually never really explained it like this. Let me repeat that. Most people, so let me actually take a step back. Yes, the unicorn research establishes and teaches you something. It teaches you that mental toughness is the only identifiable uh, thing that actually works. That's been established by science, by research. But it is in my strong opinion, and critter, don't feel bad about feeling that way because I think most people do not possess enough mental toughness that would be required to override their body, meaning deal with the metabolic health issues that the body presents that would be required to attain weight loss. So it's like outworking your body. Who's tougher, your mind or your body? And it's not really like you're, you know, kind of think of it that way. But it's challenging because the battle that your body presents is hyperinsulinemia. Elevated insulin levels are it's a very challenging scenario to override. So how do we do it? I like to be strategic. I like to combine both the mental training because mental training is everything. But then we also combine topics. We combine topics to fix the body, to fix the metabolic health issues that present barriers for your body. Does that make sense, guys? This is like probably the most quiet live I've ever had in a long time, but it's totally cool. I can just keep rambling. Sometimes I'm getting bombarded by questions, sometimes I'm not. That's totally cool. Maybe you guys are just really dialed into this mental fitness conversation, and that's cool too. Let me know. Drop a comment. Let me know you guys are breathing. Let me know you guys are here. Where are the people at? Exactly, Anna. Where are the people at? Okay, good. Good, good, good. We got some breathers. Annette's working, listening. Fantastic. Insulin resistance is at the heart of most issues with weight loss. Without a doubt, Moss man. Without a doubt. It is the basis of issues. Yeah, feel free to fire some questions. Guys, I'm here for you. I got about 15 more minutes. Can you talk about the carnivore while being on GLP-1? I'm on both. I lost 11 pounds in 2 weeks. That's really fast, you know? But how much do you weigh? Because if you weigh, 300 plus pounds, all right. But just be careful with weight loss that's too rapid. Weight loss that is too rapid will also create issues. So loose skin, muscle mass loss, things like that. Can you tell us an idea of the cost? So Critter, yeah, I can give you an idea. Like I said, they're going to recommend a program for you that's tailored towards you. But my coaching programs, for example, my student is $99 a month. My warrior goes up from there. AOD is a couple $100 a month. The GLP ones are a couple $100 a month. So the stuff adds up. Obviously, uh, you don't you don't need all three warrior GLP one AOD for the entire 6 to 12 months. You don't need that. A lot of people that are on a budget work with us for about 3 to 4 months in the higher level coaching, and then they start to decrease coaching as they develop more um, self drive and ability to execute, and they need less support. That's kind of one path to save some money. Yes, we still offer AOD. Vinny, how can I jumpstart my weight loss? You can jumpstart your weight loss by implementing strategic and targeted lifestyle interventions. Things like fasting and carnivore are my two most powerful lifestyle strategies, without a doubt. Long fasting and carnivore. Thoughts on switching to retatrutide if on maintenance? Depends. And what does maintenance mean for you? If you're maintaining your weight loss on a dose higher than 2.5 milligrams per week, you're not on maintenance. You're on a drug. You're on a regular drug dose. They might call that maintenance, but that's not optimal maintenance. Optimal maintenance is maintaining your weight loss on a micro or no dose at all. That's your choice. That's how hard you want to work. I don't think everybody will be able to achieve maintenance off the medication because there is some genetic piece to it. But I do think everybody with enough lifestyle improvement can work up to the point where they can stay on a micro dosing, micro low dose, and maintain weight loss. AOD is a fragment of the human growth hormone. So AOD is not so you don't get all the other parts of the growth hormone like the protein synthesis increase, the improved musculoskeletal healing, all that kind of stuff. You don't get any of that. You just get the fat loss, specifically the fatty mobilization. And this is a big deal because most of you are insulin resistant. And when you're insulin resistant, your body struggles to mobilize the fat. So I want to get you into fasting. I want to get you into ketosis. The faster we can do that, the faster we can address the underlying problem. But part of the problem of fasting and keto is your body's inability to mobilize the fat. And so this is what causes cortisol spikes. And if your body's sensitive to cortisol because you're, inflamed, you're stressed, you have autoimmune diseases, this is why you struggle. The very thing that'll fix you is the very thing that is too difficult for your body. So here comes AOD to bridge the gap and make it easier for you to be able to do the very lifestyle strategies that are going to fix the underlying problem. The fasting, the keto, the carnivore. It's those strategies that are going to work long term. I've run into a weight loss stall. I've never heard of this issue. Uh, I'd like to try GLP-1. How can I start? Uh, Guys, I have about 10 more minutes this morning. If you are curious how to start, if you want to learn more, the phone number here on my shirt is the best number to reach out to my team. All you got to do, shoot us a text message with your name and your email. Get yourself scheduled for the consultation. So the consultation is free, and my team will work with you to, there we go, figure out what makes sense and make a recommendation for you. What would you say to a person trying to lose weight with rheumatoid arthritis? Um, we would say that inflammation is going to be your biggest roadblock, and that we have some powerful tools to help you deal with the inflammation, like low dose naltrexone. A lot of people don't know about low dose naltrexone. It's kind of like micro GLP-1s. It's like micro naltrexone. The combination of those two medications, number one, are very safe because they're very low dose, and number two, they there isn't a more powerful combination for addressing your autoimmune inflammation. Let me repeat that, guys. I would say with high level of confidence, there is not a combination of anything that is more powerful at reducing autoimmune inflammation and non-autoimmune inflammatory conditions for that matter than the GLP-1 combined with LDN. Now, there are powerful um, biologics, powerful corticosteroids, and sure, those are very powerful too. But you guys know all too well how bad those are for you and how much they wreck your metabolic health, how much they wreck other issues. So, in the category of non destructive anti inflammatory bombs outside of AKA corticosteroids and biologics, you have these crazy things right in front of us. A low dose of GLP-1 is so anti inflammatory, and so is naltrexone. So, if you have any sort of inflammatory or not autoimmune or non-autoimmune, and you're trying to lose weight and you're not using one of these things, if you're losing weight, then great. But if you're struggling, uh, that's the first area that we would look at. Yeah, if you just started Wegovy, it's going to take time. Uh, while you're waiting for the medication to kick in, it's time to kick some ass. It's time to get to work. You have the power to make the medication work better. It's one way to look at it. Make the medication work better. It's one way to look at it. Optimize your metabolic health is another way to look at it. That's all the medication is doing. It's optimizing your health, your metabolic health. It's reducing food chatter. Well, guess what else reduces food chatter? The fasting, the carnivore, the keto, sleeping better, less stress, inflammation. All these other things also optimize your health. You just don't understand that because your doctors don't talk about this stuff. How could they? They don't have enough time. They barely have enough time to make these prescriptions. Or even worse, you're getting your GLP-1 from a big block compounding pharmacy that only cares about your money. You got lured in by the best price, hoping that all I got to do is pay, whatever they charge, 150 or 200 or 250 for the GLP-1, and all my problems are solved. It were only that easy. Ladies and gentlemen, I'm here to tell you, bullshit. You thought it was going to be that easy? You need to wake up because sooner or later you'll realize. Sooner or later, and unfortunately, spending $1,000 or 1,500 on a 3-month cycle of GLP-1, losing a bunch of weight, hitting a stall, being stuck, having no solution. Sometimes it takes all of that for you to finally wake up. Or you can just take my word for it and wake up now and do it right from the first time. How do you do fasting while on GLP-1? You just fast. No different. There's no modification with fasting. Look, GLP-1s are not like insulin. The reduction in blood glucose is glucose dependent, meaning it's not like insulin where if you take insulin and inject it, it could put you in the hospital or even worse. If you have low blood sugar or normal blood sugar, GLP-1 is generally not lowering it anymore. It only takes high blood sugar and normalizes it, which is a pretty cool thing. Same thing with fasting. In most cases, fasting does not create these crazy hypoglycemic issues in most cases. So you have two things that are lowering blood sugar in a more glucose dependent manner. And this is our bread and butter of our coaching. The fasting, the carnivore, very, very powerful. Nessa, your rheumatologist won't recommend those things because your rheumatologist, while probably very intelligent, has been doing this for so long and they are so stuck in their ways. And it's unfortunate because now you have to pay the price. So if I were you, you know, you have two options. You're not going to find a rheumatologist that works the way that we do. These things are not covered by insurance. So the GLP-1 is if it's obesity and diabetes, but outside of that, LDN's not, peptides aren't. So I always tell patients, look, if you like your medical doctor, even though they're very Western, if you have a very poo-poo medical doctor, meaning like they don't think you're going to reverse your disease, but they're really cool and that you've been with them for a while and they're really good at keeping you, alive, I guess, fine, keep them. It's good to have a doctor that knows your health, that can give you a second opinion. It's good to have a doctor who knows you and knows your body and can give you worst case scenario. That's awesome. Keep that doctor. But then you need to look for more of that preventative, holistic support to prevent disease from starting to begin with. And if you're on a bunch of medications and you want to learn how to wean off of various medications like statins and blood pressures, uh, antihypertensives, diabetic medications, it all starts with metabolic health. And so we encourage people to, when they're in our program, have that conversation with your doctor and say, look, doc, why don't you take a seat? And let me tell you something. I want to wean off these medications. And I don't care whether you think it's possible or not, but I want you to pay attention to my health over the next 3 to 6 months because it's about to get real serious here. And I need your help. I don't know how to wean off these medications. So I don't care whether you think it's going to happen or not. Do you have any concerns with me trying to do this? Is your only concern that you think I can't do it? Because if that's your only concern, with all due respect, thank you for your opinion, but I'm going to do it. Now, they might have some real medical concerns, some medical conditions, and yada, yada, yada. You got to find that out. If they don't want you to reduce your medication because blank, really bad, it's a very specific condition, okay, fine. Take that into consideration. But you have to have that conversation. You have to be willing to take responsibility for your health. It's very rare that you're going to find these primary carers and specialists that can think in this holistic viewpoint because insurance companies don't pay for them to think that way. It's rather unfortunate. It's not the doctor's fault. Nessa, thank you so much. I appreciate that. And I'm glad that this resonates with you guys. A lot of doctors are so hard headed and stubborn. I know. I know. That's why I'm telling you how to deal with it. That's why I'm telling you what to do. In fact, I'm going to make a video like this. This is a really good video idea. All right, guys. I got about 2 minutes left. Make sure you are following me on TikTok, on YouTube, all the different platforms. Turn on your notifications. Um, was it subscribe and turn on your notifications because I go live every single morning. It's very cold where I'm at, Sammy. It's actually -3. It's a good old, it's a good old crisp -3 degrees. Not in my house, thank God. But you know, I like to sleep very cold because sleeping very cold is good for your sleep, by the way. So we turn the thermostat down, but sometimes thermostat doesn't do a good job at actually keeping it at. I like to sleep at 60. I know that's pretty wild. Sleeping between 60 and 66. Ideally, most people like 64 to 66. It's really good for your sleep. But anyways, what was I saying? Is there a case of sepsis on Manjaro? I don't know. I haven't heard of any sepsis. Have you guys heard of any sepsis? Mohammed is concerned about sepsis. I would say there's probably nothing to be concerned about, Mohammed, but I can't really say that I know for sure. But we do. I want to remind you guys before I hop off today's live, we do service all 50 states, um, and meaning wherever you're at in the country, we can prescribe. And if you're outside the country, you can still do my coaching. So that's cool. But if you're in the country, we can rock and roll. We can prescribe the semaglutide, the tirzepatide, and yes, we do have 503A retatrutide, just so you know. Retatrutide is the bomb. I'm a big fan of the Reta. If you need it, if you're just getting started, you don't need the flashy new retatrutide. Semaglutide and tirzepatide work great. But if you're stuck and either of those have been working for you, now we can talk. -6 in Indiana. Whew. I'm not the only one that's freezing. Oh man, nobody's watching me on that. That's interesting. So this phone number right here, guys, like I said, this is the best number to reach out to my team. So shoot us a text message with your name and your email. Sammy, we are hopping off right now, so good to see you. Shoot us a text message with your name and your email. Get yourself scheduled for that consultation. Now, the affiliate programs, the ambassador programs, let us know if you're interested. We just filled our advisor role, so we're not hiring for an advisor right now, but we are always bringing on ambassadors and affiliates. So if you're interested in joining the team in some capacity and you want to help spread the message, you want to help spread the word, help me with my mission to help 1 million people battle obesity without lifelong medication dependence. That's what I'm all about. That's my ultimate goal. And so we do have a bunch of free resources. I want to let you guys know. This was not the year for the Niners, but we'll see what happens next year. Hopefully we can get Robert Salah, get him. I don't know how to pronounce his last name, but it's Saleh. I'd love to get him back as our defensive coordinator. Man, he was awesome. We need him back to run the defense. So the free resources, we have the free Facebook community, we have a free weight loss guide, a free peptide guide. Those are all great. Those are all within the community, though. So if you're not ready to do some coaching, for $27 a month, you can join the fam. And I think there's a tremendous amount of value for that. For $27 a month, you get access to the fam, the Flow Academy membership. That's where you get access to my rapid fire Q&As, all my guides, all my courses, Flow University. You have access to ambassadors. We do a lot of challenges, supportive challenges, accountability. It's pretty dope. I think that community is pretty awesome. And you get notified every time I hop in and go live. So check that out, guys. We can send you the direct link. Or you can become a subscriber to us on TikTok Live for $10 a month and at least catch me for my private lives. So, all right, guys, have a good day. Happy Tuesday.